Hello. We, as humans, live in this beautiful world in harmony with various bugs such as bacteria, virus, fungus, and so on. In fact, we are the complex results of the bugs through years of evolution. We are a part of them. We live in their world, they live in ours. According to, according to an updated study from the Weizmann Institute in Israel, our gut, stomach, the whole thing, where you get your food digested, things like that, the below, alone has around 100 trillion bugs. Just the gut. Our skin, which we wash it every day, which we clean, which we have a bath, all that. We have almost 1 trillion bugs who are residents there. And as a dentist, I have to talk about mouth. And in your mouth, your tooth alone, if it's clean, has around 10,000 to 100,000 bugs. Clean one, huh? And if it's dirty, it's almost 1 million to a billion per tooth, ladies and gentlemen. Now, we live at peace with these bugs most of the time with our healthy habits, clean environment. But when there is an invasion by a new bug or the opportunistic traitors that we have, our secret service and army inside the body start their operation to safeguard us. This is called inflammation, which basically what happens then is you have pain, you have heat, you have swelling, redness, and loss of function. Have you realized if you have a cut, it pains, the heat is produced around the area, there's swelling, there's redness, and you cannot use that area. So that's what inflammation is all about. Our army is working in there. Now, our army is also known as the immune system. It must be strong and armed with healthy nutrients, regular exercise, and clean environment. It needs to be both physically and mentally fit at all times if we want to keep at peace. Because once we are a little weak, the opportunistic traitors attack us. But at times, even after all the things we do, we need sometimes medical help. And actually, medicines are nothing but the missiles and the bombs to help our army fight the bugs army. And of course, with that, there are collateral damages. Sometimes our army win, sometimes the bugs win. Now, lately we've been bombarded with coronavirus and its news, which is very disturbing. So let's understand them a bit. Now, viruses are nothing but a biological entity. They exist when they are in a living organism, or like they have to be inside something to be living. They are in abundance everywhere. They are all over. They're found in plants, animals, and even inside a microorganism like bacteria. As a single entity, they can't do anything. But once they find cozy home inside our body, our cells, they can at times create a havoc like what they're doing right now. Now, it was formally studied by Dmitry Ivanovsky in 1892. Since then, we've only found around 5,000 types. And whereas the millions of types exist, we don't even know how many millions. They are of various types, can cause acute infection like common flu, which, you get a flu, your body produces an antibody, which is basically arms to fight these particular ones, and we win the battle. But at times we have the chronic ones like HIV and hepatitis ones. They are also viruses which make us really sick if not treated in time. Now, if you look at in those pictures, the one on the top, the colorful red and blue ones, is a common flu virus. The one in the middle on top is the measles virus, which you get vaccinated from as a child itself. The one that is a more like a linear thing on the that the long one is a rabies virus. Down you have the blue one, which is a herpes virus, which is sexually transmitted or in contact. And the HIV virus is in the middle down. And the other one with a yellow projection is the hepatitis virus. Then they don't have colors. This is for showing it to make us understand, because they are so small that there is nothing, no light is transmitted, that we can make it so colorful like that. They actually can be transmitted through close contact with infected people in the infective stage. Some are transmitted through air, like, if you're close to a person who's sick and he just sneezes or coughs, and you get that some of the particles, the aerosols inside your nose and goes into the lungs and all that, that's where you get it. Some are through bite, like the rabies and all those things. Sexual contacts like HIV and hepatitis can be through that. And blood transfusion, sometimes a mistaken blood transfusion can cause that. If you look at all the viruses, most of the ones with the projections, those projections actually help them to get attached to the surfaces of our body and attack us. Now, if you really want to understand how big are these viruses, if you look at your human hair, our normal hair, it's around 70 microns. And these bugs are almost 0.02 to zero point 0.3 microns. They are very, very small in size, almost 3,500 to 250 times smaller than a human hair. They are much, at times, so small even than the bacteria. They can only be seen through electron microscopes. A human hair's width is, if it's 70 microns, you can actually, in the width alone, can accommodate around 1,000 viruses. You can line them up, 1,000 of them can live in just 70 microns. So you can understand how big these viruses are. Now, our interest today is the coronavirus. It is named such as it has crowns-like projections. It is known to be originating from animal, but now causing human-to-human transmission through close contact with infected people. Through the cough, the virus can be inhaled by people around them. The touch, like the hands. That's why hands are the most important one of the things that can cause and that can help in transmission of this disease. That's why hand hygiene is one of the most important thing in prevention of any diseases, and especially this one. Now, it is found to be maybe coming from the bats, we don't know, or it could be pangolins. That's what the new findings are showing towards. And then it went towards human transmission in an unprotected environment where somebody sneezed or somebody coughed and you got those aerosols inside your lungs. Or hand hygiene like that. You used your hand to close your cough and you shook hands with somebody, or another person can get in, like infected person can infect another one like that. And the whole world, 3 continents, 28 countries seem to be in panic right now, worried, so that we don't want more infection going on. More than what is being caused is something called infodemic, which is causing the entire economy, global economy, to fall. From oil prices going down to tourism, sports, healthcare, everything in doldrums. So, ladies and gentlemen, infodemic is causing a bigger problem. Of course, it's been told by WHO that it's just going in the global crisis right now. Hopefully, it will not go into the pandemic form, but infodemic is causing a big doldrums in the entire world today. Now, when we revisit the old pandemics that world has suffered in the last century, this particular century, we find out that the death rate of this one is pretty low. It's just around 2%. Whereas if you look at the bird flu, which killed almost 52% of the people that it infected, but it only confirmed cases was just 861. Ebola, 39.52% death rate, but only 28,616. And MERS, the Middle Eastern one, which is caused 34% death rate, SARS 9.6%, but this one is 2% alone only. But look at the number and the rising number that is there. That's what is a little scary. Well, we may say influenza kills 290,000 to 650,000 people a year as per WHO, but this a new virus, new unknown thing. How many people are going to die? We don't know. How many people are going to be affected? We don't know. So we have to be careful. I'm not trying to scare you here or all that. I'm trying to make you informed. As of now, coronavirus cases are 34,915, out of which 17.4% of them are in a severe condition. So they have a lot of discomfort that is going on there. Only 2% are have the death rate, but there's a lot of suffering, like almost 17% are suffering because of it. I hope this trend will go down soon. And I'm sure with all the efforts that's been done by the international community and China, it is going to be controlled soon. But in the meantime, as humans, what do we gotta do? Number one, instead of shaking hands, let's practice things like namaste or a Japanese bow, which we can actually help us to prevent transmission, because hand hygiene and hand when not used, because hand goes everywhere. So if we keep our hands in right place, they say, we can actually prevent a lot of transmission. It seems to be the main source of infection for bacteria and virus. Even in the hospital, acquired infection, hand hygiene is given so much importance. So these things, at least for now on, will be very useful. It may feel a little impersonal, but it'll definitely help in transmission. And washing hands frequently, another one, seems to be the most important thing that we do. Every hour we can wash our hands with proper soap and water, and when we wash our hand, we just see a lot of people washing just a little bit. No, we have to go inside, we have to go between the fingers, we have to clean it completely, not just one surface alone. We have to clean it. Thorough cleaning is a must. And we can also use things like hand sanitizers frequently. We can carry in our pockets so that we can keep our hand high bacterial level in our hand always at a lower level. And a lot of times we see people sneezing and coughing in a wrong way. I mean, you're not supposed to. I mean, people sometimes cough without any cover. That's totally wrong. But at the same time, a lot of times people use their hand to cover their mouth when they sneeze or cough, which is not a good idea, because again, that hand will go and touch somewhere, something, and shaking, and that's how we transmit diseases. So rather than using our palms, let's use our elbow. We cover the elbow with an like nose as well as mouth, and go. And nobody's going to touch your elbow that much. Anyway, sometimes you do, but that's very unlikely. People will go and touch your elbow, but hand could be everywhere. So another thing, people pick their nose or put their hand in the face so many times. Let's avoid that. Eyes, just going around the eyes. So we should avoid that as of now. And of course, not doing coughing with our hand covered or without it. Always with an elbow. Now, next thing we can do is, when we are going to the public places and all that, we can use a mask. Now, simple surgical mask does not work. We need to use something like N95 respirator, which may help. Virus size, if you look at it, we don't know the exact size of coronavirus right now, but they're expecting it to be around 100 nanometer. That's like almost zero 0.1 microns. And these masks actually work for around 0.3 microns. So it may not protect us directly, but in a situation where you have to go to the public places where the masks and all that are totally covered, the one that covers the entire nose, does not allow anything to go in, this kind of mask may aid us in preventing us from a lot of diseases. And another thing we found with this one is also through the eyes, it seems to be infected. So using eye protection will also definitely help in the future. So it's better to be safer than sorry. Another thing, when we talk about hand hygiene and all that, the most dirtiest thing in our body today, which we it's like an extension of our body itself, is our cell phones. Please do not forget to disinfect this also periodically. When you disinfect your hands, it's a good idea to disinfect the phones also, because phones carry the most of the bugs, and we need to make sure there are no bugs. And if you have in your family old, like 65-year-old or above, or young children, vaccinations, pneumococcal for pneumonia seems to be a good idea. So this could be another thing that can be implemented in consultation with your physician, because there is a regimen, there is a proper when to do it, how to do it. So please follow that. Don't do it yourself. It has to be done by your physician. And from our part, we have been already practicing in our meetings and all that, the namaste or a bow, and that's been beautiful. Another thing I can see is the xenophobia and racism that is going around the world. Just because China has a problem. China has got a population of 1.386 billion, and there are just around, what the cases that are being affected right now is 0.0000025% of the Chinese population, and the whole world is always talking about the entire Chinese as a suspect. That's not a good idea, guys. We have to work together. We have to help one another, but not point fingers at one another. When we were in trouble, we may also get into trouble. So we should not be just promoting this kind of racism, xenophobia in the social media and all that. Please refrain from doing that. After all, at the end, I would like to reiterate that it's all in your hands. It's all in our hands. And clean hands save lives. Thank you very much.